To the extent that we live our lives in a manner that is consistent with the truth in our heart, we thrive.
Welcome to the Meier Clinics podcast, and you just heard a quote from one of your hosts, Dr. Lisa Day. Join our licensed clinical professionals from various backgrounds as they discuss fascinating mental health topics with a wide range of guests. Meier Clinics is a Christian counseling organization with multiple clinics nationwide dedicated to treating the whole person, emotionally, physically, and spiritually. Welcome to our listening family. We thank you for joining us.
Hi everyone, this is Kristen Sononta-Walker, host of Mental Health News Radio, and we are doing an introduction of Dr. Lisa Day, who works out of the Idaho clinic. And I wanted to say, Lisa, Dr. Day, thank you so much for coming on and helping us promote this new venture.
Oh, I'm excited to be here.
So tell our listeners about a little bit about your educational background in terms of, the behavioral health field.
You betcha. My background is I have a bachelor's degree as a registered nurse, and at that time thought I was going to go into neuropsychology, and I thought that would be a good background of having both the medical understanding. So I have a bachelor's degree as a registered nurse. From there, I went on to get my PhD as a clinical psychologist. I got that at the University of Georgia, and I graduated with a specialty in behavioral medicine. Mm-hmm. So my educational background comes as a combination of being a registered nurse and a behavioral med clinical psychologist, which for me helps me integrate the mind and the body, the health and its impact on how we function emotionally, psychologically, and physically.
What I love about this, when I first saw your bio and it said Lisa Day, RN, PhD, I thought, oh boy, what an interesting combination for mental health because of that RN piece, because nurses are such the frontline caregivers and mental health is as well. So that's a really unique combination that I think puts you in a special category of being able to give that kind of compassionate care to your patients.
Well, and not only in compassionate care, I mean, I didn't plan it that way, but retrospect, it's about the perfect background as a clinical psychologist, because oftentimes there are medical contributions to anxiety, depression, OCD. And so oftentimes when someone comes into my office, I'm going to assess for thyroid disorders, adrenal exhaustion, hormonal imbalances, and nutritional imbalances, so that we can look at baseline health and functioning as it might relate to different areas that they're struggling. So for me, it's a natural relationship. It's a natural symbiosis, particularly when women are moving beyond 40, heading into perimenopause, menopause, and postmenopause. Additionally, the thing that I love about the two is psychotropic medications. So I have a thorough understanding of the impact and how psychotropic medications work. And so that dual combination really helps me both refer folks for medication management, but also get a feel and understand who would benefit and who would not benefit. So it's worked well for me.
That's fascinating. And all of the shows that we've done where Dr. Paulmeier has talked about medication, those get a huge spike in listenership because people are wondering what can help me. What is it that's going to be the one that is the key to my lock? And I've learned too as a patient that it is like that. Just because Lamictal, for as an example, works for one person, or Pristiq or Zoloft or whatever works for one person, it doesn't mean that it's going to work well for someone else.
Well, and that's what's really neat about, in my practice, what's really neat about being a nurse is I can refer folks out for medication, and I usually refer with a narrowed down idea of what they would benefit from, but I can monitor, because I'm working with them in outpatient therapy, I can monitor the effects of it. And the other neat thing, after 25 years of doing this, is you get an idea of a profile of who responds to what. And so it's both helpful in the referral and in the monitoring, and then also dealing with the frustrations. And, some people would agree, some people would disagree, but in my experience, antidepressants, anti-anxiety, psychotropic medications in general, they're effective about 40% of the time.
Right.
And the reason I think that's important is people come in struggling and in pain, and then they don't get a benefit from the psychotropic medication, and they feel that they're untreatable or there's something really wrong with them. So, I like having that piece of information there. The other piece of it is that from my nursing background, psychotropic medications have an assortment of side effects. And so being able to educate folks who are going on antidepressants prior to what those side effects can be just better prepares them for how they respond to the different medications.
Interesting. So what are, you've piqued my interest here, and I know I can hear, I can go back to emails we've received. So I can tell our listeners would be asking, if someone, is outside of that 40%, what are some of the paths that, that you would take with someone? I know there are many, but just an example of a path you would take with a patient that hasn't been successful with a psychotropic medication.
Sure. We typically refer to them as treatment resistant,
Mm-hmm.
and not that they're resistant to therapy, but they're not responding to any meds. And so certainly with those folks, we're going to operate what I would say ground up, inside out. And so first and foremost, we're going to look at nutrition. Do they have plenty of protein in their diet? Are they taking vitamins and supplements? As a nurse, what I cannot deny in any way, shape, or form is that generally our general public is very deficient in vitamin D. So out of the gate, I'll talk about taking vitamin D on a regular basis, taking a B complex because that helps regulate our moods. Definitely take an omega-3 fish oil because that helps in neurotransmission, and some other ones as they seem appropriate. From there, in therapy, one of the cornerstones of the work that I do is based on the phrase, that which you think you become. Your thoughts create your reality. And so with one who is treatment resistant, if they are telling themselves or have a schema developed that nothing's going to help me, this is the rest of my life, I'm never going to feel good, we can pretty much count on that being the outcome. And not that I want to teach people to thought stop, but certainly to be aware of how their thoughts influence what they're experiencing.
I had that happen with a friend of mine that, was treatment resistant, and that was the ongoing theme always for years was, I just can't be helped. I just can't be helped. All pharmaceuticals are bad. The things that have been done to me have been horrible. And it got to the point where they were even arguing with their veterinarian about the care of their dog. And that kind of clued me into, okay, I understand that you are treatment resistant to medication, of course, but you're also arguing with your vet about the care of your dog. So I'm kind of wondering if some of this has to do with you, and not necessarily that every doctor that went to medical school doesn't know what they're doing.
Oh, certainly. Well, being angry and frustrated, for sure. But even, Kristen, with the treatment resistant to the pharmaceutical medications, oftentimes we can move toward trying supplements such as L-tryptophan, L-tyrosine. GABA is real helpful for anxiety. We can use some of the natural valerian or melatonin for sleep. And I see a great deal of benefit depending upon the presentation of symptoms with those.
Yeah, that's, again, having your medical background is what makes that's a great juxtaposition there too. So what led you to the Meier Clinic?
I have been with Meier Clinics for 25 years.
Wow. And that is someone who loves where they work.
This is kind of a fun story, but I'll share it briefly. And I graduated from University of Georgia. 6 of us graduated at the time. And my colleagues were going to the Mayo Clinic, Johns Hopkins. Some was going to UCLA. And my friends around me said, "Where are you going?" And I said, "To Rocky Mountain National Forest." And they laughed and they said, "What are you doing?" I was going to go hiking. I was going to go backpacking after this, 10-year, endeavor in education. And they said, "Are you nuts?" And Kristen, I said, "No, God has a plan." And I went backpacking in Rocky Mountain National Forest. I was out there for 2 weeks, and I came in on a pay phone back in those days, checked my voicemail. And there was a message from a man by the name of Dan Hartman with Meier Clinic West.
Yeah.
And he was interested in me coming to interview. At the time, I didn't know what Meier Clinics was. I didn't know that it existed. I had applied to a small hospital in Seattle because I figured it would have an outpatient program for psychology, a small psychiatric hospital. Anyway, the long and short of it, I drove from Rocky Mountain National Forest to California, down to Laguna Beach, and had the honor of having an interview with Henry Cloud. And during the interview, Henry gave me a book to read because he had to step out for a moment. And it was only then when I opened the book panel and realized that I was interviewing with the author of the book. and then I lost all concept of what my education was, what theorist I studied, what I wanted to do with my life, and I had to read or anything about psychotropic medications. Anyway, long story short, Henry Cloud, John Townsend, and Dan Hartman were roommates in college, and I was interested in working with Dan up in Seattle. So the story's been from there. I came up to Seattle, worked with Dan Hartman for 20 plus years. I was the director of the outpatient clinic there. And then about 4 years ago, moved to Sun Valley, Idaho to open up what we were going to try as a satellite clinic. It's a small town, it's a ski town, but there are not a whole lot of PhD clinical psychologists here, maybe one or two, and it's just taken off.
I'm sure.
I have been with Meier Clinics for 25 years.
That's amazing.
Yeah.
That's amazing. And, you know, it's funny, the whole history we know from having Paul on our roundtable shows, Dr. Paulmeier, that he just thinks so highly. He just talks with glee how proud he is of many people, one of them being Dr. Henry Cloud. So I've said this, he was one of his mentors. So I love that full circle that brings that around. And they're all wonderful people, and they've contributed so much to this field. We feel lucky every time we get to do a show with Dr. Meier.
Absolutely.
And he'll want you to interview him too, so get ready for that.
Oh, I'll get ready to it. Hopefully I will see him here in the next couple of weeks. I'm headed that direction. And so I would look forward to that.
Yeah, absolutely. So tell our listeners a little bit about, what do you want to focus on? Because there'll be 4 of you that are doing different, you're going to have your own guests come on, and I'll be there moderating. But I'm not the host. You all are doing the interviewing. So give our listeners an idea of the kind of people that you would like to interview and the subjects that you are interested in covering. That will change in time, I know, but right out of the gate, what are your thoughts on that?
Oh, you betcha. And I would say that I have an eclectic approach in psychology. Formally, I'm trained as a cognitive behavioral therapist. My postdoc was in object relations. And so I've pulled, and in the years that I've studied and practiced, I've pulled in from all different areas. And with regard to specific topic areas that I find stump me, if you will, today, are some of the challenges with ADD, ADHD. I'm both a mother of a child with severe ADHD, and I work with families and parents of kids with ADHD a lot. And, one of our challenges is the stimulant versus the non-stimulant,
right.
The coping mechanisms, do we treat, do we not treat? One person who I would love to speak to is Kathleen Nadeau, Nadeau. She's got some fantastic literature on ADHD, particularly in girls. Other areas that I am very interested in is, I don't know if you're familiar with John Rosemond. He has a book called Teen Proof. And I teach that quite often in my work, and only because the teenage years can be quite challenging and stressful for parenting units and families. Yeah, those. With regard to how I operate and some things that I teach is, my population is primarily adult. However, because I'm in a small town, over the years, I've accepted clients as low as about 14. And my approach when folks come in is I take a look at what I would say their operating system. I mean, obviously, I'm going to look at symptoms and challenges, but I look at their operating system, and then we look at what's working and then what's not working. So it's a bit of a blend of medicine, psychotherapy, and coaching to help them look at what kind of skills they need to utilize. So I'm heavy on skills training. So as far as my work, I probably would like to interview more people in the area. I do a lot of work with, unfortunately, with grieving. The suicide rate right now in our country is soberingly high,
Yes.
Especially with teens. I do a lot of work with boundaries.
Boundaries.
What else?
That's a huge topic.
Boundaries.
That could save, just focusing on that could save so many people in terms of codependency issues.
Well, it's true. I once tried to advocate for beginning in the 3rd grade, probably even younger, to begin to teach our kids about boundaries. I mean, we had home ec in my day. I don't know how much of home ec we see in the schools today.
Not anymore, really,
but I think boundaries, as we know in the field of psychology, is cornerstone to healthy relationships.
Yes.
Without boundaries, we have difficulties with our attachments. We have difficulties with communication. We have difficulties communicating our needs, our wants, our limits. So boundaries is a big part of the work that I do.
All right. So interviewing some experts in those areas is going to do a lot for this podcast. So that's going to be wonderful. It's going to be exciting to see, who you send to us and say, set up this person to come on.
Absolutely.
So as we wind down this interview today, everyone can find out more about Lisa Day's background, or also go to Meier Clinics, MEIER clinics.com, and find out information there as well. But as of right now, what I'd say, Lisa, I want one last question answered from you. Why did it appeal to you? Because there are many people that work with Meier Clinics, at Meier Clinics. So why did this offer that went out for, who at Meier Clinics would want to do a podcast, why did that appeal to you?
That's a great question. And in the work that I do, if I am asked once, I am asked multiple times. I've been offered for people to write it for me, to come co-author. Repeatedly, people will ask me, where can I read about this? Where can you refer me to? And as I mentioned a few moments ago, I have an eclectic collection in both my assessment, my philosophies, and my teachings. And for a good 10 years, that's a consistent message on a weekly basis. Lisa, where can we read about this? And I've been telling them that for the last 6 years, no 7 years, no 8 years, I've been trying to finish a book. And I've not been able to, because I'm the mom of a 17-year-old and a 19-year-old, and there's just haven't been the time. So the number one reason I responded and said yes is that I'd like to get my word out. I believe that I teach a little different perspective. I teach with the combination of both nursing and psychology and a tremendous amount of personal experience. I tell folks, Kristen, when they come in my office, that I won't teach them anything I don't practice personally on a regular basis. And so that's my reason, is hoping to make that accessible to broader masses.
Fantastic. Well, thank you, Dr. Lisa Day, Lisa, for coming on and doing this first show. And I know, along with our listeners, I'm certainly very excited to see what's to come.
Thank you.
And thank you to our listeners.
Hi, this is Dr. Paulmeier of the Meier Clinics. We're reminded in Jeremiah 29:11 that God has good plans for each of us, plans to give us a future and a hope. When you're going through difficult times, it's important to remember that important truth. Our Christian counseling staff at the Meier Clinics will also come alongside you with encouragement and biblically based counseling.
This message is sponsored by the Meier Clinic Foundation, a nonprofit Christian counseling ministry. The number is 1-888-7-CLINIC, 1-888-7-CLINIC.
We hope you enjoyed this podcast. Tune in next time for another engaging discussion on relevant mental health topics. If you have any questions about Meier Clinics, please visit our website at meierclinics.com. That's MEIER clinics.com, or call us at 888-7-CLINIC. Don't forget to leave us a review on iTunes, Stitcher, or any of your favorite podcast apps. And please note that we are a member of and produced by Mental Health News Radio Network, MHNRnetwork.com.